Willkommen, this is Julia.
And this is Shane. And this is Think Plant-Based. Think Plant-Based. Make sure to check out recipes, health tips, travel tips at www.thinkplantbased.com.
And we're officially on iTunes, so please rate and write us a review on iTunes.
Write us a review. Give us 2 stars, 3 stars, maybe 5 stars. Let us know.
For sure, 5.
Yeah, I mean, who would give us 2 stars anyways, right? But yeah, make sure to do that because that's how we get found.
You think it's sometimes quite confusing? What's the healthiest way to be plant-based?
Definitely. You hear research that says eat more meat, then you read a research that says don't eat any meat, then you read research that cheese is back, butter is back.
Right, and after
what are the answers?
10 years, you're going to feel like being plant-based doesn't work?
Yeah, I don't know. Joe Rogan thinks that plant-based doesn't work. But good thing our guest can clarify some things for us. Dr. Matthew Nagra, how's it going?
Good, how are you?
Yeah, pretty good, pretty good.
Pretty good.
So we finally got someone who can clarify things, because I'm not an expert by any means.
Right. But there's so much confusion out there, even more and more, like we see veganism is growing more and more, but there's still more confusion now happening.
Yep, all the time. Misinformation everywhere.
Yeah, right?
Yeah. So tell listeners a little bit more about yourself and what you do.
So I've been vegan for just about 9 years now. I'm a naturopathic doctor, so I work with people mostly on lifestyle intervention, diet, exercise, and all that to treat a lot of their chronic diseases or whatever it is that they have going on. And here in British Columbia, we're actually considered primary care physicians. So we pretty much see and treat all the same stuff as a family doctor. And while we do have the ability to prescribe medications as well, we like to use other modes of treatment as well.
That's awesome.
Wow.
Yeah. Those are the doctors I want to go to, right?
Yeah, right?
Yeah,
Exactly.
get all these pills and that's first thing. Oh, yeah, you need a prescription.
And you feel comfortable with, you can actually say, yeah, I'm vegan, and you don't have to worry now hearing from the doctor, you should have more like animal protein in your diet.
Yeah, well, actually, what I always tell people is when they're given recommendations like that, just ask them why. Have them explain to you why they want you to do that and why it's going to help, because that's where people get stuck. A lot of the nutrition information that you get handed, even from healthcare professionals, is really just personal opinion. It's not really based on the research a lot of the time. So that's just the most powerful thing you can say yourself is just why, and ask them to explain why.
That's great. Yeah.
Right?
That's a great advice for people going to their doctors. Ask questions. Why? Why is this like this? Why do I have to do it?
And you're always in control. The patient is always in charge in any kind of a medical setting. Just oftentimes you trust the doctor's judgment, rightfully so, because they've gone to school. I've gone to school for 8 years to do what I do, but I also don't want people just to take my judgment at face value. I want them to ask questions. I want them to ask for resources if they want to see them, and they can make the decisions for themselves.
Yeah. So what's an easy way to stick to a plant-based eating when you have such a crazy busy life? Being a naturopathic doctor, seeing patient to patient.
Exactly. How do you even have time to eat?
Well, it's funny. Before starting my new practice just a couple months ago, I was way more schedule oriented, and that I had the same kind of breakfast, lunch, and dinner every day. I'd eat them around the same times. But now with my schedule all over the place, like Mondays I'm working late, Tuesday mornings I'm in there super early. So I just eat very simply. I don't do a lot of the fancy stuff. My breakfast is just oatmeal with berries, and I'll throw some flax seeds in, and just a really simple meal. My lunch is just a quick bowl I throw together. If I'm really in a rush, sometimes I'll get this quinoa bowl from this place across the street from my clinic. And then for dinner, it's just really giant salads. I throw in some greens, broccoli, a bunch of sweet potatoes, and beans or tofu for all the calories. And then I'll just make my own quick little avocado-based sauce, or maybe a lemon tahini kind of dressing. But I just eat super, super simply. I think people often believe that plant-based diet is super complicated and takes forever to prepare. And really, that's only if you're doing the super fancy stuff.
Right.
If you're eating just super easy, whole foods, plant-based meals, they tend to be pretty quick.
That's true.
Right. So how do you have time to prepare all these meals? Do you do prep work, in the evening before the next day, or?
I'm the worst for prep like that. So
takes time.
Again, like I said, I eat super simple. So if, for example, Mondays I'm going in late, I start at 2:30, I end at about 8:45. In the morning, I'll have my breakfast, I'll have my lunch, and then I'll make something for dinner and take it to go. Like I just do it day of. Yeah. Might have some leftovers to use on the Tuesday for lunch, because that's the only meal I'll really need at the clinic. And then again, I'll make dinner that night, and I'll use the leftovers for Wednesday. So I'm not somebody that does the whole week long batch cooking type thing that a lot of people do.
Yeah.
I think it's great. I think I definitely should do that, but I just tend to do it day before, day of. With my schedule, it works totally fine.
Right.
Yeah, whatever works for you, right?
Yeah, exactly.
Everyone's going to be different. Some people need a big gourmet. They have the time to do it and enjoy it. So,
we like to soak our beans, and then we cook a bunch of them, in a big pot, and then we put them in a container, and then we freeze them. We freeze a bunch of containers.
And then we bring them out in the fridge and just make sure we always have some type of legume from the freezer into their fridge, so we can always eat some on the go.
Right.
Yeah, that really helps. Yeah. Or like quinoa, we'll make a big batch, put it in the fridge, and
and that
lasts for a couple days.
Almost yeah,
you can get about 3 days out of it before it starts maybe going a little bit old and not as fresh.
And especially investing in something like, say, an Instant Pot or whatever just makes life so easy when it comes to that. Like the batch cooking beans or grains or whatever takes no time. You don't have to do anything. It's just you stick it in there and it just gets done for you.
What's your take on the Instant Pot for like health wise as like cooking food?
It's one of the best ways to cook food to maintain nutrition.
Okay. Yeah. That's great to know.
It has to do with the short cooking time more than anything,
right?
Because while temperatures might be higher, same with the microwave. Actually, temperatures will reach such higher temperatures, but it's for a short period of time, so you actually maintain a lot more nutrition that way than you would otherwise.
Well, we better get an Instant Pot then,
shouldn't
we? I was always worried about things, like when things are quicker to cook. I'm always lenient about health-wise to go and maybe go on that trend, because we know we've seen like the microwaves and the things like that. So it's just waiting until the research is out.
I would recommend if you know of nutritionfacts.org with Dr. Michael Greger. He actually put out some videos on pressure cookers, and so you can watch those, and he looks at all the research on pressure cookers and how it affects nutrition, and it's definitely one of the best ways to cook your food.
That's great. In this day and age, we need quicker beans.
Right. You still want to eat healthy, but it needs to be quick, right? That's the key.
Totally.
So what should a healthy vegan lifestyle definitely include? Because it's more like a lifestyle too, not just a diet, right?
I mean, talking about the diet first, you just want to make sure you're getting all the different whole plant foods in your diet on a regular basis. So that's your fruits, your vegetables, your legumes, whether that be beans or chickpeas or tofu or lentils, and then some of your nuts and seeds, and really emphasize the dark leafy greens. So that's really it. It's super simple. People often want to complicate it. It's not that complicated. Just make sure you're eating a variety of these healthy foods, and make sure you're eating enough of them, because there are so few calories in plant foods compared to animal-based foods or processed foods for that matter. And then outside of that, of course, exercise is super important, exercising every day. Surprisingly, we often hear recommendations of like, say, 20 to 30 minutes of exercise per day. Well, for vigorous activity, what's optimal is probably more like 40 minutes. And for light activity, like brisk walking, for example, is more like 90 minutes a day. So even our recommendations aren't quite where they should be, but just making sure you're doing at least something every day is going to go a long way. And then there's stress management as well, whether that be through meditation, yoga, or people have their own ways of doing it. Exercise itself could be a mode of stress management. So those are really the main areas I would try to hit.
That's
really good points.
Do you suggest supplementation of any kind to go along with the vegan diet?
Yeah, I think vitamin B12 is super important for anybody on a plant-based diet. Given that we live up in British Columbia, definitely vitamin D is really important for most of the year, because we don't get that much sunshine, and even when we do, it isn't super powerful. And then one that is maybe a little more controversial is an algal oil, so like an omega-3 supplement that's sourced from algae instead of fish. But the research on it is pretty mixed, whether it helps or not. So that's more up to the individual. I definitely think during pregnancy and lactation, it's really important for the developing brain of the infant or fetus during pregnancy. And then for later life, it tends to reduce risk of things like Alzheimer's. So that might be a good idea as well.
Mm.
Oh, that's awesome.
Right.
So you actually said D throughout the year in British Columbia.
I would say throughout
right?
the year, there's maybe a few months you can get away with if you're out in the sun regularly, exposing a lot of your skin. But for most of the year, because the issue isn't just that we need sunshine, we need hot sunshine to produce vitamin D in our skin. So we're only getting hot sunshine here, maybe, May through July or June through August, somewhere in that range. The rest of the year, we just aren't. Even if it's sunny out, we're just not getting that hot sun that's going to help produce vitamin D.
Especially in Vancouver, where the rain factor is like 4 to 1.
Exactly.
Cloudiness,
Yeah, I've actually noticed a big difference. I used to not supplement. I mean, here and there with some vitamin D. And the last couple years, I've been really focusing. Okay, when it's like September, October, start supplementing it. And I've actually noticed a big difference in how I feel during the winter months. It's quite amazing.
Yeah, for sure.
I mean, I've been vegan now for almost 20 years, and most of the time I didn't even supplement with vitamin D. I mean, I grew up in Germany, so it's a bit different there, but I don't know, it wasn't really too much like the topic, like when I heard it.
Yeah, it's so subtle, like the differences. Like I don't have like this crazy burst more of energy, but I feel less sluggish, and like my brain's a little more
sleepy,
yeah, I'm not as sleepy. When I wake up, I don't feel as like groggy, and it just helps. I think it helps with my circadian rhythm and just kind of, keep my hormones in check.
Right. And can you recommend like a vitamin D3, because not all of them are vegan, right?
Yeah. It really depends. There are a bunch of different companies. Like I have one from AOR, which is a company that I use at my clinic. There's a bunch of ones that you can get if you go to, say, Whole Foods or Choices. You just look up the vitamin D section of the supplement aisle, and they'll say on them vegan. If it says vegan, they're vegan. If it doesn't say vegan, most of the time they aren't. But I wouldn't be too concerned about a particular brand, to be honest. I don't think it really matters. Yeah.
Okay.
That's good.
So there's a lot in the media now, like talking about like why actually vegans fail. Like, what do you think?
Yeah, they don't have enough collagen.
They say, I started feeling better when I ate meat or eggs and stuff like that.
Yeah, so most of those concerns come from people who are having gut issues. And so when you've got, say, IBS or SIBO or something where your just gut isn't functioning properly, you've maybe got some damage to your gut lining, and you eat a bunch of fiber, the fiber is going to irritate it further. The fiber itself isn't the cause. It's not like the whole plant foods cause the issue, but they're letting you know that it's there when you eat those foods.
Right.
So what my kind of theory behind that is when someone goes to eating something like eggs or fish where there's no fiber, they're finally absorbing a lot of that nutrition. They're finally getting some of the fat and the calories from the food. Of course, without the fiber, it's not going to aggravate the gut either. And then they feel better. When they're eating more fibrous foods and they can't properly break it down and they've got some damage to their gut lining, then they're going to have symptoms and probably not absorb all that much. And that's what's going to lead to just feeling worse. But the problem is it's a Band-Aid solution to go with the eggs or the fish or whatever in that case instead. And there's a really great program now from Dr. Angie Sadeghi, who's a plant-based gastroenterologist. It's called Your Gut Connection. So if you're someone who's struggling with gut health, you can go to yourgutconnection.com and read up on the program. And it goes through 6 phases of just starting off eliminating any kind of aggravating foods, just going down to very simple, like starchy vegetables, well-cooked starchy vegetables, starchy fruits, cooking your vegetables, just things to make it super easy to digest. And then each phase, which lasts about 2 weeks per, you build up slightly more of the tougher foods to digest until you get into like the fermented foods at the end. And they seem to be getting really good results with it. And so it's definitely something I'd recommend.
Oh,
yeah,
really
I think a lot of people underestimate the gut and like what it does for the body, like the brain-gut connection.
Definitely.
Yeah, it's huge.
Yeah, but it's also important to know the root cause, why do you have these bacteria? Can you give like some guidelines for people, like what are usually the causes to get like the indigestion and stuff like that?
Oh, there's so many. Yeah. So you just talked about the gut-brain connection. Well, even things like anxiety or other mental health issues can cause poor digestion. There's also, if you eat a lot of red meat or eggs with all the choline and carnitine, they help foster bacteria that's actually harmful to us and produce harmful metabolites. So if you actually take there's this molecule that's produced by our gut when they're subjected to carnitine or choline called TMAO, it's called TMA, and then it goes to your liver and gets converted to TMAO. And it promotes atherosclerosis, prostate cancer. It's very oxidative and inflammatory. But the crazy thing is, if you feed those same things to vegans don't produce it. And that's because the vegans don't have the bacteria in place to break it down. And so it's just more, if you're eating those types of foods for your whole life and then you switch to a plant-based diet all of a sudden, it's not necessarily that the plant-based diet's causing this issues. You've been eating those things your whole life, and that's the bacterial environment you've created inside your gut. So it shouldn't be, or the plant foods itself shouldn't be targeted as the cause of these issues. It's letting you know that there's an issue there, and they were caused from these previous things you're doing. Mind you, processed foods, terrible as well. No fiber in that, tons of sugar, feeding all the crappy bacteria. There's just so many different reasons. Individual food sensitivities can cause issues with gut as well. That's something that's going to be super individual, though. It's not like I can point at any particular food.
Right.
There's tons of, when it comes to gut health, it's so complicated. And
we still don't even know, right?
Right.
Yeah, exactly.
Just to get a bit of an idea, right?
We just started to scratch the surface, right?
I saw Dr. Sadeghi speak at the Plantation Conference in September, and she had, I don't even know how many slides on the possible causes of SIBO, which is small intestinal bacterial overgrowth, and it's fairly common now. It's one of the causes of irritable bowel syndrome type symptoms.
Right.
And it was just, I don't know, probably like 50 potential causes or something. It was just a massive, massive list. And so, there are so many different things that can do it.
Right. Well, I'm glad you mentioned stress, because that's really...
It could be even your environment, right?
Like, exactly.
Do you know if there's a plant beside you and there's, different environment, it could cause your ecosystem in your stomach and everywhere to go all out of tune. So we're complicated beings, that's for sure.
Yeah.
We
There's
are.
not one size everything.
And we're more bacteria than we are human. So that's something to keep in mind too.
That's true.
Yeah, exactly.
More bacterial cells in and on us than we have human cells.
I just want to tell the listeners that used to be like vegan or like plant-based, they can always come back. It's not like now they start eating meat and they feel better, but they kind of deep inside in their heart, they feel like, wow, I'm actually still connected to the vegan lifestyle. They can always come back. But
and I don't blame any of them either. Like they get a lot of hate online, and I've seen a lot of that happening. But it's not their fault. It's a failure of the healthcare system, really, because we aren't taught how to deal with people who are plant-based or vegan. Always, people are being recommended non-vegan treatment options because the healthcare provider doesn't know how to work with someone within a vegan framework. Now that's actually worked out pretty well for me starting my practice, because I'm getting all the people who are just tired of getting those recommendations from their past healthcare providers. And in most cases, I find that these people who are, say, ex-vegans or whatever you want to call them, they tried a lot of things before going to those measures. They tried everything. They tried all the recommendations that were given to them, and nothing worked. And it's because nobody was probably able to address the cause and find the true cause. And then they start giving these other recommendations that really aren't backed by research. Like, I'm not sure of any research stating that eggs or fish improve digestive health.
Well, I guess Joe Rogan says so.
Yeah,
so it must be true.
Yeah, exactly.
Right? That's a tricky thing.
I just made a whole post about his whole game changers thing.
Right. Yeah, I'm glad you did, because there's so much confusion out there. And I feel some people just think, oh, well, Joe Rogan's a great guy. He has all these great guests on his show. But that's pretty dangerous to trust someone that is not even a doctor or anything, no scientific background really.
Or a research, like a published researcher, right?
In his case, he's actually admitted to not knowing that much. I remember when he had Kevin Smith on his program, who had a heart attack. He's a famous Hollywood director, if people don't know. He had a heart attack, I think maybe a year and a half ago, something like that. And then he actually went vegan afterwards, and his health is greatly improved. And then Joe Rogan's talking to him about all this, and both of them just straight up say, we're both just two idiots. We don't know anything. We're just, they're just talking about their experiences and stuff, which is fair enough. You can, but when he starts talking about it as if it's scientific fact or whatever, that's when I have an issue.
Yeah.
Right.
Because he's just not familiar with the actual literature.
I feel like you get a lot of that on YouTube. Like people look for information on YouTube and they're like, well, this person had this, so I'm going to self-diagnose or this and that, this worked. I feel like we get a lot of misinformation from YouTube. And I think it's
not
scary.
just YouTube. Dr. Google too.
Yeah, Dr. Google. Right, because
we call it Dr. Google because everyone just Googles their symptoms.
Yeah, I got a stomach ache, and it's like you're dying, and you're like, whoa,
it's like stomach ache. Yeah, you look up stomach pain, it's like stomach cancer. You look up headache, it's brain cancer. You look up, whatever you look up, it's cancer. All of a sudden,
right?
And
Google's
it's really
based on how it's not based on the most truest information. It's based on who's clicked on it the most and the most favorable amount of time someone has looked at a website.
Definitely.
Yeah.
So you think you're getting this quality of information, but really it's just whatever they boosted up on the Google ranking system.
But then in there too, there are gems. Like there are some really great online resources too. Obviously, nutrition facts are already mentioned. There's some great YouTube channels, but just of course they get mixed in with all the other stuff too.
Yeah, it's getting really hard to find and weed through all the mud to get what you're looking for through the internet these days.
There is. But I mean, Joe Rogan really cares about vegans in a way, I mean, bad publicity is good publicity
on,
for us.
Every podcast that he's had for the last little while.
Right.
Yeah, he talks about it more than vegans do.
Yeah, and we're like, dude, why you keep talking about it then? And then like, it's weird, but
it is.
Hey, at least people are talking about it, right? So
yeah, we're getting out there.
Yeah. So what's your thoughts on, we're going to switch to diets. What about like a keto diet, plant-based or not, like a high fat?
Depends what for. So if it's, I mean, there are certain types of epilepsy that's been shown to be effective, especially if the drugs are not tolerable or if they're suffering from side effects. And in a case like that, the benefits certainly outweigh the risks, right? The benefit of not having seizures is going to outweigh most risks you can possibly have.
Yeah.
But then that often gets extrapolated to, it's good for seizures, therefore it's good for brain health. And, it's so ridiculous. Like Dr. Michael Greger does a great analogy. He's like, well, what else is good for seizures? Brain surgery. So why don't we all just get that? There are obvious risks and reasons for not doing it. Now, obviously it's big in the weight loss world now.
Right.
But even with that, it's primarily water weight that we're losing really fast, and during the initial period we actually might lose more muscle, lean body mass. Fat loss actually seems to slow down when compared to a higher carbohydrate diet. So there are issues there. They've actually done research on CrossFit athletes who are on the ketogenic diet, and their quad muscles actually shrink because they're losing muscle. What? So there's all these claims that are being made about it, but and we have controlled feeding experiments, not controlled feeding experiments, metabolic ward trials where you test. You have these people in the room. You test everything. You test, their weight loss, fat loss, muscle loss, or gain, and all of those measurements. And like I was saying again, fat loss slows, the muscle loss actually speeds up, and the higher carb approach seems to be better. But if somebody really wants to do keto, I think the plant-based keto is a far better option. You can consume way more fiber, which is going to be super important. And I know it's not really a scientifically validated study, but Dr. Danielle Belardo, who has a podcast as well, she actually did a little trial with her own health and actually measured her lipid levels before and after. And she actually didn't have any changes in measurements like cholesterol, triglycerides, and all these other things that I would have expected to change. So there's potential there. It's just not something that's been really studied that much.
Right. It's not suitable for everyone.
Yeah. And I feel like people equate being skinny or being in shape to health. And I think that we need to stop talking like, okay, well, you lost weight. Great. Like, are you healthy? Oh, yeah, because I'm skinny. I'm like, no. That has really
But even then, what are they losing?
Yeah.
They're losing more of their muscle. That's the problem, right? On the scale, it looks good, but what's actually happening isn't all that good.
Exactly.
Well, because you're probably shocking
too, right?
your body, putting in like a fight or flight, right? Because you're starving it of glucose, right? For your brain,
especially.
Is that correct? Like how that works?
I mean, that could be a part of it. Well, one of the main arguments for the whole keto diet is that you put your body into this fat burning state, which is true, right? When you're breaking fats down into ketones, you are breaking fats down. The issue is you're consuming so much fat. So all of a sudden they think that this fat's coming from all your body stores and everything. It's like, well, you're packing in so much more fat that even if you're increasing your fat burning capabilities, you're still putting in purely fat. And so that's like just a major issue or flaw with the logic on that too.
Yeah.
Right. Yeah, so I watched a Netflix documentary about keto, and they were talking
Magic
about, that was what it was called.
Yeah.
Yeah. Because, you can't just run, I don't want to watch it. I don't want to know all the information. Like, I was curious, like, why are people so stuck on it? And yeah, it looked good for people with seizures, but they're trying to sell it as this magic pill.
What was it called, actually?
Magic
so, okay.
No, but it's also called Atkins, right? It's
it's just another word. They've been regurgitating the same diet with a different name for like 20 years, 30 years. Like,
and with the magic pill, there was very little science presented in that whole movie. I watched it with a friend of mine, and I just kept getting triggered. I was like watching it, and I was just getting so triggered watching it because they're making all these claims, and there was like no science to back it up. Now, if you go watch the Game Changers or something, they've got references in the bottom left corner of like every point they're making, and the study showing up on the screen as well. And the whole magic pill documentary was based on one family's anecdotes. That was basically it. It was one family's anecdotes on a child who had a terrible diet, processed food, junk food diet that's high in sugar and stuff, which nobody's saying is healthy, onto a keto diet, which included some more vegetables and stuff as well. It's going to be an improvement regardless. Yeah. But I couldn't believe how much traction that thing got, and how it was. I saw it all over social media and everything when it was based on very little. There was hardly any science actually presented.
Yeah. It was, I don't know, I just remember watching it, and then they were just like it says, the magic pill for anything. You got eczema, go on keto. He's like, you got cancer, go on keto. And it's like, huh? Yeah. Like,
let's talk about cancer for a second. So because one of the reasons for the whole keto thing too is they want to starve your cancer cells of sugar, which makes sense.
Right.
And there are actually some trials with certain forms of brain cancer where they put people on a ketogenic diet along with chemo, and it actually seems to make the chemo more effective. So that's great. The issue is people will apply that to cancer, period. And what they leave out is that ketogenic diets actually promote other forms of cancer. So certain cancers feed on ketones, like breast cancer, for example. I believe like some types of skin cancer also feed on ketones. So it can actually make other cancers worse, but because there's this little bit of research out there for one particular type of cancer, they apply it to all cancers, and then they're putting people on a diet that's actually going to make their condition worse.
Right. Yeah, I feel like they do that a lot. Like there's only a little bit of research that says something, and then, I can make money off of that, and sell them the magic pill or the dream that they're looking for. But
then when people get off the keto diet, then their body shape becomes the same after a while.
Yeah,
that'll go carbs, that'll go for just about any kind of diet, though. You go out. That's why we want to make long-term sustainable lifestyle changes instead of just a temporary diet.
But they show off like the keto diet works, but then it's like, okay, once you're off,
clever marketing.
Yeah,
clever marketing.
Totally. What I noticed is though, like talking about Joe Rogan again. Sorry, he was like saying like he can't believe like meat causes like diabetes. What's your thought about that?
It just does. Like I don't know what else you offer. The research is very clear on that. That the more saturated fat you consume, the higher rates of diabetes. We have studies. It's called they used a euglycemic clamp. So what they do is they maintain a absolute constant blood sugar, and maintaining a constant blood sugar and infusing them with fat causes insulin resistance, causes diabetes in a matter of hours. So we literally know that we can turn somebody diabetic by injecting them with fat. We know that for sure. Diet-wise, you can do very similar types of studies. Been done over and over. And then Dr. Neil Bernard did a 74-week randomized controlled trial where he had two groups, one group doing the low-carb American Diabetes Association recommended diet. So it wasn't even just a random low-carb diet. It was like literally the diabetes recommendations. versus a low-fat vegan diet. The low-fat vegan diet resulted in greater reductions in blood sugar, greater reductions in hemoglobin A1C, which is a marker of blood sugar control, also lowered cholesterol more, lowered other lipid markers more. It ended up being better across the board. And the most important thing was people's adherence to the program and their evaluations of how accessible it was and how easy it was to do was similar amongst both groups. So I always hear the argument that, nobody's going to do the whole foods plant-based thing because it's too hard. Well, apparently they were just as willing to do it and thought it was just as easy as doing the low-carb approach. So that's not an excuse anymore either.
Yeah, right. So plant-based fats are okay to eat, like even if it's sometimes high? Like there's not the risk really. Like
it's such a debatable topic. I personally think that for the average healthy person, doing whole plant fats, so your avocados, your nuts, seeds, those types of foods, totally fine in whatever amounts. But for somebody with diabetes or for somebody with heart disease, right now, the research that we have shows a low-fat diet works. Right. So until we have other data, which we just don't, that's probably the way to go, and that's the safest way to go because we know for sure it works.
Right. That's great. Yeah, I noticed like a lot of people, not a lot, but some people in social media are now showing off with the carnivore diet. Like, how is that even sustainable? Like they just want to show off, or what's that all about?
Oh, I have no idea. It's just new, and it's something that we don't have research on, which is always the argument I get. Is if I talk about how we know that eating more animal products is worse for us, they'll argue the quality of the meats, and then they'll say, well, we don't have research on people doing full carnivore. And so what they're saying is that they think all the mountains of research we have showing that more meat consumption, especially red meat, leads to higher rates of colorectal cancer, heart disease, or just overall mortality. They're saying that once you go from eating a lot of that to eating only that, all of a sudden there's going to be a change, and like to like a decreased risk. It's like we have these trends. We have these trends that are so linear, and like we know that it increases risk. I just can't understand how they would possibly think that going 100% into that realm would somehow reduce risk. It just makes zero sense to me. I mean, they're kind of doing a study right now, by adopting this, and we're going to see what happens. And I don't think it's going to be very good. Well,
blood tests don't lie. And if you've ever seen some of those carnivore diet people,
Sean Baker. Sean Baker is the big name one. His blood tests are horrendous.
Yeah,
low testosterone
of like what was it?
An 80-year-old. He was literally diabetic. But then they just used excuses. His excuse for testosterone was the fact that it's lower. He'll always talk about his deadlift. Yeah, but then he talked about testosterone being low as like, oh, well, my testosterone's more, or my testosterone receptors or whatever are more sensitive, therefore I need less testosterone. Just like, just really non-scientific answers like that to make excuses.
Yeah, and they always like try to pick apart the science too. Like, oh, well, that was epidemiology and that can't be, we throw all that out. And then, like, they bring in an epidemiology thing of something else to their point.
Oh, if we throw out epidemiology, then we can't say that smoking causes cancer.
Right.
Like, we don't have randomized controlled trials. No. That was literally based on very consistent evidence from things like cohort trials, epidemiology, and all that.
Yeah. Yeah, because I feel like with paleo people and Chris Kresser, he tends to find things. He always talks about cherry picking, and then I do his research, and he's cherry picking the same thing, but he's throwing out all the 80%, 60, 70% of the science will say one way, and he chooses the other 30 and goes with that.
Oh, did you happen to see my post on the Game Changers?
I did, yeah.
So he just misquoted stuff left and right. He was talking about how the research on the Seventh-day Adventists didn't control for factors like weight and tobacco, when they clearly do. Like, I should just actually screenshot that and send it to him. And then he was talking about how the Ornish, he was calling the Ornish diet a vegan diet, which it wasn't. It included low-fat dairy. So again, he's wrong. And then he's talking about how the health benefits were because they were just adopting an overall healthier lifestyle, and which is okay, fair enough. That's a fair criticism. But then he doesnn't even mention Esselstyn's research, where it was just diet, nothing else. It was just it's like to the point where it's dishonest, or at least it seems dishonest. I give him enough credit that I think he's smart enough to know that research already and that he's looked at it already.
Yeah.
maybe he hasn't, and okay, give him the benefit of the doubt, but I think he has, and I think he's smart enough to know that. And that's just the issue. Like, I don't like when people are giving this kind of information that is harmful to people and fear-mongering people.
That's what I think too,
and that's millions of people that are going to hear that and be like, oh yeah, well, he's a chiropractor that does research, so I better trust him.
Right, and he was at Joe Rogan, so yeah, he has some credentials.
Yeah, well, it's just unfortunate that, Joe Rogan's got sponsors in the meat industry. You can't really dumb him down, really, because, he's being paid by them, so...
Well, doesn't Chris Kresser sells animal products?
Well, yeah, he sells collagen, supplements. I'm sure he sells it all.
Some supplementations that include
that's one thing.
Contain animal products.
But I don't think I've ever seen him publish or be in the science. Like, he'll read the science that he wants to read, but he's not in the science. Like, he's not doing these experiments.
The thing is, I don't think he needs to. I don't think that matters. Like, look at Dr. Michael Greger. He doesn't do research. He just analyzes it very well.
Right.
And I don't think you need to be the ones doing it. It's actually really funny. I think it was Robert Lustig did some research on sugar and, claimed that carbohydrates are what cause weight gain and all these other issues. And Garth Davis essentially proved him wrong about his own research with, some mistakes that were made or something. So just like having done it yourself doesn't even mean you're the expert on that topic, because Garth Davis did a really good job. It was on the Doctors TV show, actually.
Yeah, we saw that.
Yeah.
That's so annoying. Yeah, but I feel even Chris Kresser's kind of bitter about when he was vegan. He failed, but he did. You don't even know what he really ate. Like,
he said he was a raw vegan. He said he didn't supplement with B12. So right there, I already have issues on what he's claiming is the death of a. And he can't prove that that vegans aren't getting nutrients. Like, he always says that we're nutriently deficient because we're not getting an abundance of nutrients from the meat. But come on, we all know, we can look at chronometer, we can see what we're doing.
We don't even need chronometer.
Yeah, we don't need
there's a study done just a few years back in Switzerland where they compared omnivores to vegetarians and vegans, and the vegans weren't even really supplementing B12. They had low intakes of B12. They actually consumed more sugar than the other groups. So these weren't particularly super healthy vegans or anything, or at least they weren't taking special care of their health like we would in the whole foods plant-based community. But they were just better off nutrition-wise than the omnivores or the vegetarians in most categories. They didn't actually even have higher rates of B12 deficiency, funny enough, and all sorts of.
Then Chris Kresser would say that's the healthy user bias.
Healthy user bias, yeah.
Can't be true. Healthy user bias. I don't trust anything. Just you could use that for anything in science.
The whole healthy user bias. The whole healthy user bias is what he uses to discount, again, like I said, the Adventist research, when they control for those factors. And they are literally comparing the healthiest vegans in the world to the healthiest meat eaters in the world.
Right.
That's literally the comparison they're giving. And it just drives me nuts.
Yeah, because they always say the healthy user bias. I'm like, no, look at the research. They're counting for smoking, drinking lifestyles. It's not just like, oh, well, yeah, I don't even want to get into it. We have a whole podcast about Chris Kresser, Joe Rogan.
Do?
No,
you have a whole episode?
We could. I was saying we could call you and we'll have a whole episode about it, because you can talk for hours about it. It gets ridiculous.
That's what happens. But I feel there's a war now, with some meat eaters and
propaganda.
Vegans. Yeah, they even see veganism as a propaganda. Are you kidding me?
We have nothing to gain other than animals not being tortured and killed. So
people can call us biased for that, and that's fair enough. Like when someone says I'm biased, I'll agree. Yes, I have a bias, but they do too. That's the thing. Everybody has a bias, and they just don't like to admit that. Like Chris Kresser, for example, with his past experience, that has jaded him a little bit in the whole plant-based world, and that in itself makes him biased because of his personal experience. Or people who enjoy eating animal products, that in itself gives them a bias. Hell, I like eating bacon. Therefore, I should be considered less biased than somebody who still eats it. You know what I mean? Like, I like eating it, but I don't eat it because A, it's terrible for you, and B, I don't want to cause unnecessary harm.
Yeah. Right.
So there are so many different ways to look at that, and everybody's got some source of bias, but you just have to try to look at the evidence objectively. And when I get people trying to debate me on whether it be Instagram or whatever, I'll just ask them for sources. And people can message me their sources. That's fine. I'll take a look at it. But most of the time they don't. because it is based on things they heard in places like the Joe Rogan podcast.
Right. So
Exactly.
Matt, what do you say when someone says stop forcing the vegan propaganda on me?
Because we're forcing it. It's science, right?
Well, it depends what exactly kind of situation you're talking about. I tend to not tend to not start the conversation. I usually, if somebody else, like a lot of people on my soccer team now, especially because of Game Changers, are wanting to try it, and they're asking me, and I'll talk to them all day about it.
Nice.
But it's not like I went up to them first and was like telling my whole team to go vegan. I just lead by example as the top scorer on my team. So
Right.
I think that's better activism in that sense. But when it comes to forcing beliefs or whatever, I believe wholeheartedly that people who eat animal products actually force their beliefs on vegans far more. I think that happens way more. I think vegans are far more discriminated against all the time. I know people who have had issues at work because of it, and very immature things going on with their coworkers. And usually, people first thing they'll say is, "Oh, sorry, I'm ordering whatever," as if I said anything, and I didn't. I didn't say anything. So I think there's a huge misconception there.
Yeah, there is.
It's funny, whether we judge them or not, they still think we're judging them.
Yeah, exactly.
So it's like, well, you must have something on your conscience, because I wasn't going to say anything.
And then thinking we're judging them is in itself judging us.
So we're always at a loss, I guess. They just don't want to admit that, maybe we shouldn't be doing this harm to animals, and it's not the best way to go about doing stuff. Totally. If we don't have to, it's unnecessary, right?
Yeah,
so.
right.
Yeah, for sure.
Do you have any advices for listeners that really want to go 100% plant-based, but they kind of feel too shy, like especially when they're in the work environment or in school, and they want to have more friends, but they feel like they can't get more friends when they go plant-based?
Honestly, it's like, well, for starters, on the friend topic, I would suggest to most people that they actually look for vegan or plant-based type events in their community, whether it be potlucks or maybe some animal rights stuff that goes on. You meet really great people that way, and you'll often, like, I find a lot of the newbies end up going to those types of things. So you'll see people who are only maybe a few months into their journey, and you guys can kind of learn together. I think that's really good. As for dealing with other people, I mean, you don't need to, especially early on while you're still learning and you don't have all the facts, and arguments are just going to be exactly that. They're just going to be arguments. You don't have to be overly vocal about it. Just if you're having a plant-based meal at school or whatever, just have it, and people might ask you about it, and you can tell them what it is. But you don't need to right away try to convert everybody. I think it's going to be a lot more effective if you get more comfortable with it, and then educate yourself more about what the nutrition aspects, the environmental, the ethical, I don't know that I've never had that from friends where I've really been say bullied. I've heard of other people who've dealt with that, which is really unfortunate. So maybe I'm not the best person to ask about that, just because I didn't have that personal experience. My friends tended to be very supportive. They'll throw the odd joke here or there, but I'll throw it right back at them. So
but you're confident, right? That's the key. You got to be confident, but if you're not, right, if you're shy, you got to work on your confidence, I feel.
And I think that comes with knowledge. So that comes literally with educating yourself.
Yeah, exactly.
Totally, yeah.
Like, if someone wants to make a joke about, vegans not being manly or whatever, I'll say, vegans have higher rates of testosterone, or now I'll just point them to the Game Changers.
Let's see.
Yeah. Now I'll just point them to the Game Changer scene and let them watch that. I have it recorded on my phone so I can show people if I ever need.
Oh, wow.
Ooh, wow, smart.
A little 5-minute scene.
Nice.
Yeah, exactly.
So how are the responses then from the people you show it to?
Do you get a lot of
hilarious.
discrediting it?
It's hilarious. No. I think it's hilarious. Like, everyone just laughs. People just laugh at it. It's super funny. The way that it was done was so well done. And the funny thing is, so people want to discredit it, like, Joe and Chris were doing on their podcast, but they're doing a randomized controlled trial right now on that. So they're actually doing a proper study now, and they'll publish it. And once those results come out, I'd like to see them, try to debunk that as well.
I wonder who funded that one.
I'm not sure. I mean, it gained so much traction. I'm pretty sure you wouldn't get too much of an issue.
Yeah, right.
Finding somebody.
Yeah, exactly. So, any exciting future plans?
Yeah.
Ahead? Yeah.
Future plans. Well, I just got asked to speak at the Penticton Veg Fest, so I might be coming there to speak. Still just working at the clinic. That's number one. I'm working on building a web page right now, which is almost ready to launch. So that'll just be mostly some of the information I share. If I was to write any, say, blog posts, they'd end up there. It's mostly like a hub for all my stuff. So whether it be podcasts, like once this podcast is up, I can have it on there. And, just that kind of thing, booking links and contact links and so pretty simple. And then I actually just put in a application to speak at the American Association of Naturopathic Physicians Conference, which is the largest naturopathic conference in North America, I believe.
Where is it?
So that'll be in July. It's a big conference for my profession coming up in July. So I just put in the application. Not sure yet if I'll end up being on there, but I think there's a decent chance. And if I do end up going on there, it'll be to talk about like the myths behind a plant-based diet. So things like iron, protein, that kind of stuff.
Right. Where will the conference be? Do you know yet?
Yeah.
It'll be in Denver, Colorado.
Oh, okay. Nice.
In the summer or winter?
Yeah, right?
July. It'll be July.
Okay, good.
Oh, okay. Nice.
That's good to know.
Wow, you have a lot going on.
Yeah, busy.
Yeah.
Oh, and actually in Vancouver, there's a zero waste event coming up, the zero waste vegan market. I'll be speaking at that too. So people just keep asking me, and I just keep saying okay. So
yeah, you need to get that website up so they can follow you.
Right.
Yeah. So how can the listeners find you? Like, where's your practice and best way to contact you?
So I'm practicing at Tanumi Integrated Health on Commercial Drive in Vancouver. You can find me on Instagram at Dr. Matthew Nagra. So it's dr.MatthewNagra. Same thing on Twitter, but I honestly don't use it very much. And then for Facebook, it's just Dr. Matthew Nagra ND. Should be pretty easy to find. And then I've got all my info there. So on my Instagram page, I've got the link in the bio there. And if you click on that, it'll take you to the booking website as well as past podcasts or articles or whatever that I've written. But that'll change once the website's up.
Right.
The website link.
Wow, we can't wait.
Yeah, let us know the website. We'll put it up in the show notes and we'll have everything up there if anyone wants to contact you and needs some help. Yeah.
Right. Well, thanks again for your time.
Yeah,
You're welcome.
Thanks
for having me.
And the knowledge and and debating about Joe
Rogan.
Exactly.
So this was one of the more aggressive ones I've done.
Yeah, sorry.
Well,
we
that's
got really
good. You need to show people, vegans can be a bit aggressive too if we need to, I mean, it's okay.
Yeah.
And very inspiring, we admire your work and we need
Thank
more
you.
people like you. And, you just about getting started here, I think,
you just got started.
Yeah.
You're going to be like a rocket ship and going to like...
to the moon. And
yeah,
back.
exactly.
Yeah.
But no, I see a lot of things happening in a great way,
Thank you.
We're so actually blessed to have you in Vancouver.
Yes.
We need more people like you everywhere in the world.
I agree.
Yeah, definitely. So keep up the great work, and we see you around.
Yeah, we'll talk soon. Yeah. We'll do a game changer, Joe Rogan.
There you go. No, I want to see him. He said he would have James Wilkes, the main guy from the Game Changers, on his show. So I'm hoping he does that. We'll
I want him to have Gregor on there.
Michael Gregor,
that'd be great.
Because or Garth Davis.
Yeah, or Garth Davis, because those guys I think would be a better fit to battle it out.
That poor Dr. Khan, he got beaten
poor Dr.
up.
Khan, I feel like was just in a corner and they were 2-on-1 pouncing on him. So redemption.
Yeah.
So let's see what happens.
It'll happen, man.
All right. Well, have a great day and take care.
Yeah, we'll talk to you soon.
Talk to you later.
All right.
Bye.
Ciao.
Bye.